Bismillahirrahmanirrahim. Okay, yesterday we discussed about chronic inflammation and a variant, a pattern of chronic inflammation called granulomatous inflammation. Two things we discussed, and we did some small brief introduction about osteomyelitis. So, inshallah, I'll start again with the introduction of osteomyelitis. So, you will have the continuity. Okay, osteomyelitis means yesterday discussed osteo means bone, myel means we represent bone marrow, itis means inflammation. So it's a inflammation of the bone marrow and the bone, but we mean it is a infection of the bone. We mean it is a infection of the bone. We don't call it as a just a inflammation, because inflammation can come in many ways. There are many causes for inflammation, but here when we say it is osteomyelitis, which we mean that it is a infection of the bone, infectious condition of the bone. So it is a infectious process, and infection always leads to inflammation. It leads to inflammation, then inflammation leads to destruction of the bone, and that leads to bone necrosis. Okay, bone necrosis means bone death. So this is the whole process happens in osteomyelitis. So if you ask me to tell the definition of osteomyelitis, it is an infectious process involving various parts of the bone, various components of the bone, characterized by inflammatory destruction of bone, which leads to bone necrosis. If you understand the concept, infection producing inflammation, inflammation producing necrosis, as simple as that. Okay, so this is about osteomyelitis. Before going to the osteomyelitis of the bone, so osteomyelitis means it's in the infection in the bone. Let us discuss some basic things about bone, just as a revision. Just we'll take example as long bone. Okay, the long bone, let us know about the structure of the long bone. It has two end, right? The long bone has two end. The ends are called as epiphysis. Ends are called as epiphysis. The connection between the two end, it is called shaft of the long bone. It is called as diaphysis. Shaft means there is a connection between the two ends, that is called diaphysis. In between the epiphysis and the diaphysis, we have a special layer, special stage called metaphysis. This metaphysis is just between the growth plate and the diaphysis. This is the growth plate and this is the diaphysis starting. So this area is metaphysis. Understand? So if there is growth plate, it is easy to define. If the after a period, like after adult, once the person enters the adulthood, the growth plate disappears. Afterwards, we just mark a line by assuming it is a growth plate. Understand? So that's how we mark metaphysis. So what I want you girls to know is there are three things, right? Ends are called epiphysis, shaft are called diaphysis. Between the epiphysis and diaphysis, we have metaphysis. Okay, so the outer layer of the bone is covered by a thin membrane. It is, you cannot remove it. It is very tightly attached to the bone. That is called periosteum. Very very important layer, because through that only the blood supply comes. It is called periosteum. Inner layer is called endosteum. But outer part of the bone, it is a compact bone. It is called cortex. Inner part of the bone is a spongy bone. It is called medulla. These are all, you must be knowing from anatomy. Just I am telling you as a revision so that you can understand the osteomyelitis. Okay, now regarding the blood supply of the bone is different when the baby is 0 to 2 years. Okay, what is the difference? Just I draw in a whiteboard. See, for example, this is one end of the long bone. What is this? Epiphysis. This is diaphysis, and most probably this could be the area of metaphysis. Okay, so normally the blood enters the diaphysis, the blood vessel enters the diaphysis, and they go upside and down. Okay, and they give branch, and the branch travels towards the metaphysis, and it takes a U-turn and comes down. Okay, like that they keep on going. You understand? They keep on going to the metaphysis, and they keep on supplying the metaphysis. Okay, if the baby is like 0 to 2 years, if the individual is 0 to 2 years of age, there is another blood comes to the epiphysis, that is called epiphyseal vessel. That is called epiphyseal blood vessel. Epiphyseal blood vessel. If it is 0 to 2 years, there is a connection between, there is connection vessel between epiphysis and metaphyseal vessel. There is a connection between epiphysis and metaphyseal vessel, that is called transphyseal blood vessel. Transphyseal blood vessel. You all understand this? So see, normally the blood supply starts coming from the diaphysis, right? They enter the, this is called nutrient artery, because they bring the nutrient to the bone. They enter they pierce the periosteum, they enter the cortex, then they go inside the bone, then they give upside and down branch, and then they go about till the metaphysis, and they take the U-turn. So hairpin bend they call. You know hairpin? You know hairpin? Okay, so it's like hairpin bend. So, and this, or you can call it as a U-turn. Okay, so it keeps on making U-shaped turns. Okay, that is metaphyseal blood vessel. That is metaphyseal. This is what? And please don't talk. Metaphyseal blood vessel. Okay, and there is a separate blood supply for epiphysis. There is a separate blood supply for epiphysis, that is called epiphyseal blood vessel. You all understand? Okay, now if the baby is around 0 to 2 years, okay, if the individual is around 0 to 2 years of age, then there is a connection. What is that connection? There is a connection blood vessel which connects the metaphyseal blood vessel with the epiphyseal blood vessel, that is called transphyseal blood vessel. That is called transphyseal blood vessel. So keep this basic in your mind. Okay, so this kind of vasculature is seen in 0 to 2 years of age. Okay, if the 2 years of age is crossed, see what is this? This is growth plate. This is growth plate. Understand? Growth plate is made up of cartilage. Growth plate is made up of cartilage. Okay, growth plate is made up of cartilage, and this is, the growth plate will be there till, for example, 20 years of age. 18 to 20 years of age, till at 18 to 20 years of age you will be seeing the growth plate. Okay, so now this is the vascular architecture of the bone in 0 to 2 years of age. In 0 to 2 years of age, I am going to draw vascular architecture of the bone 2 to 20 years. 2 to 20 years. in 2 to 20 years what happens, this transfacial, after 2 years the transfacial vessel disappears. The transfacial vessel disappears. Understand? There is no connection between metaphyseal and epiphyseal vessel. There is no connection between metaphyseal and epiphyseal vessel. But there is growth plate. Understand? Okay, now I am going to draw the vascular architecture pattern after 20 years of age. After 20 years of age. What happens after 20 years of age? The growth plate disappears. The growth plate disappears. Understand? So this is above 20 years of age. The growth plate disappears. You all understand the three vascular pattern, vascular architecture. In 0 to 2 years of age, there is a growth plate and there is a connectivity. Connection between the metaphysis and epiphysis. In 2 to 20 years of age, there is growth plate, but there is no transphyseal vessel. The connection is lost. And after 20 years of age, there is no growth plate. There is no growth plate. There is no transphyseal vessel. Okay. Why I am telling this is important to understand the infection of the bone. It is important to understand the infection of the bone. Okay. Now, okay. Now let us take green color. Okay, now the infection most of the times they travel in the blood. Okay, the bacteria travels in the blood and it can enter the bone. Okay, if the person is having an infection in any part of the body, they are always have a high chance that the bacteria can travel in the blood that can reach the bone. For example, this is the blood vessel contains bacteria. Okay, it is traveling and it reaches the it goes to the metaphysis. When they see the U-shaped turn, do you think the blood can flow very fast in U-shaped area? Yes or no? Blood can travel fast or slow? See, for example, you are traveling in a car. Okay, this is the road and your father is driving or your husband is driving, he is driving very fast. And do you think that in the U-turn also you drive very fast? Okay, if you drive very fast, it will upside down. The car will become upside down or skid. So automatically there are some guys they do like that, but normally human being will not travel very fast in the U-turn, except some few guys. Okay, now so when the like that only the blood flow is also like when the blood is flowing, when it sees the U-shaped turn of blood vessel, the blood slows down. Flow slows down. The flow slows down. So in this area, the blood flow will be fast or slow? It will be slow. When it is slow, the bacteria can settle there. If the blood vessel is fast, the bacteria cannot settle. It will be moving. Understand? So if the blood vessel is slow, the bacteria settles there. And once the bacteria settles there, it will trigger inflammation. So if it is a bacteria, it is an acute inflammation. Which cell will come? Which cell is involved? Which inflammatory cell is involved? Mashallah, neutrophil. Okay. So the neutrophil will come and the neutrophil will take the bacteria. What will happen? They will kill the bacteria. They also die and they form pus. Now the pus is formed in the metaphysis, right? In the metaphysis. So when the pus is forming, there is some fluid collection, right? Inside the bone, in the metaphysis, that will create pressure. So the blood flow is obstructed. When there is pressure, the blood cannot enter. It is obstructed. If there is no blood flow, what will happen? That is ischemia. So this part of the bone goes for necrosis. If there is ischemia, it will end up with necrosis. Now you see, there is infection, inflammation, the pressure goes up, blood flow is obstructed, ischemia, necrosis. So this is how you should understand. Okay. So now there is necrosis, right? So then the pus is increased. Necrosis creates more pus, right? So now the pus is increased. Now the periosteum is very strong membrane. So they cannot cross the periosteum. They go below the periosteum. The pus will go below the periosteum like this. So now the periosteum will be elevated. And the pus will be going like this. You understand? Once again I tell. Okay. Now let us take a fresh bone. Okay, let us draw green for the bone. So what is this? Diaphysis, right? What is this? Metaphysis. What is this? Epiphysis. Okay. Now consider this is 0 to 2 years. What will happen? Let us draw the blood vessel. The blood vessel enters, then goes up. There will be growth plate, right? And now the blood vessels go to the metaphysis and takes U-shaped turns, right? Then it is 0 to 2 years of age. There is a epiphyseal vessel coming to the epiphysis. What will be seen here? There will be a connection vessel. That is called transphyseal blood vessel. Okay. Now let us consider this child got infected. Now the bacteria is entering the blood. Then it goes to the, according to the blood flow, it travels, right? It goes to the where? Metaphysis, and it slows down, right? Here this area is a U-shaped area, hairpin bend. It slows down, it settles. Okay, it settles down. Okay, once the bacteria settles, they multiply and they form more bacteria. When they form more bacteria, now the bacteria is increasing, that will trigger inflammation. Which cell will be coming? Neutrophil. Will come and they try to take the bacteria, and they also die and they also kill the bacteria, because the lysosomal enzymes kill the bacteria as well as the neutrophil, and they form pus. Understand? So now there is a connection between metaphysis and epiphysis. So this pus can travel in the blood and they can go to the epiphysis. You understand? So in the children 0 to 2 years of age, infection starts in metaphysis, it spreads to epiphysis. Till this you all understand? Okay. So because why? There is a connection called transphyseal vessel. Okay. Now let us see what happens if they are 2 to 20 years of age. If they are 2 to 20 years of age, what happens in 2 to 20 years of age? Please tell me. There is no transphyseal vessel. So there is no chance of infection going to the epiphysis. You all understand? Okay. Now I am going to tell the clinical importance. Very, very important, because 50% of the questions will be cases. Okay. If you don't understand, you cannot answer the cases. So now let us draw again. So this is long bone, right? This is one end. Okay. Other side there is another long bone, right? That is the joint. That is the joint. Now it is 0 to 20 years of age. Now it is 0 to 20 years of age. Now the blood supply goes into the periosteum, enters the bone, goes to the, there will be growth plate, right? There will be growth plate, and the blood vessel enters the metaphysis, and they form the hairpin bend or U-shaped turns. Okay. And there is a epiphyseal vessel which supplies to the epiphysis. It is 0 to 2 years of age. So there will be connection between these two vessels, that is transphyseal vessel. Now the infection, the bacteria is in the blood, and it is going to the metaphysis, and in the metaphysis the blood flow slows down in the hairpin bend or in the U-shaped area. The bacteria settles. When the bacteria settles, they trigger inflammation. Neutrophil comes from the blood and they kill the bacteria, and they also die. Understand? Now it is 0 to 2 years of age. So the infection, the pus can go into the transphyseal vessel, and it can spread to the epiphysis. It can spread to the epiphysis. When they go to the epiphysis, it can go to the joint, right? It can go to the other bone. Understand? So this is osteomyelitis. Okay. When they involve the joint, it is called septic arthritis. It is called septic. Septic means infection. It is arthritis. Arthra means joint. Arthritis. Understand? So in 0 to 2 years of age, the infection can become from osteomyelitis into septic arthritis. You all understand this part? Hello? Hello? வணக்கம். யார் பேசுறீங்க? சொல்லுங்க ஜி. நான் கிளாஸில் இருக்க, உங்களுக்கு கால் பண்ணட்டுமா திரும்ப? என் நம்பர் மாறிடுச்சு. என் நம்பர் நோட் பண்ணிக்கோங்க. 055 32 82 024. 12 மணிக்கு மேலே கால் பண்ணுங்க ஜி. Okay. Okay, now this is, you understand, in 0 to 2 years of age, the infection of the bone, that is infection happening in the metaphysis, through the transphyseal vessel, it enters the epiphysis. Once they enter the epiphysis, the joint is very near and the other bone is very near. So it can involve the joint directly. It can involve the joint directly, and they cause septic arthritis. Understand? So that's why infection in the children you should handle very carefully. otherwise it will spread onto the joint immediately. You have to treat very aggressively, understand? So this is very important. Now let us discuss what happens in 0 to 2 to 20 years of age. I think now you girls can tell me what are what. One second, I'll go to the screen again. See, now it is one bone, it's a joint, and it is 2 to 20 years of age. You see growth plate, right? And the blood vessel goes and makes a U-shaped turns, okay? And there is epiphyseal vessel. So what is the difference here? There is no transphyseal vessel, okay? Now the infection comes to the blood and the bacteria travels. Where it settle? Metaphysis in the U-shaped areas, right, of the blood vessel. And the neutrophil comes, they form the pus, the infection is established. This is osteomyelitis. Okay, now do you think it will enter the epiphysis? Yeah, they can. Why they can directly enter? No, there is no blood, there is no transphyseal vessel, but they can directly enter, right? Epiphysis is not like Riyadh. Okay, it is very near. Okay, it can directly enter. It's like Mecca, so you can enter directly, right? Yeah, yeah. I'm asking a question. Why it cannot enter? Why? There is no. Come on, Bashar. There is. Mashallah, because of this growth plate, because of the growth plate, because the growth plate, the pH is different. You know pH? The pH of the growth plate is different because it's not a bone, it is a cartilage. Bacteria cannot survive there. Bacteria cannot survive there. But if the bacteria can survive, if they destroy the growth plate, then the growth is stopped. Then the growth is stopped. It is very dangerous bacteria. Understand? So normally in 2 to 20 years of age, the infection will be in the metaphysis. Infection will be in the metaphysis. They will not travel to the epiphysis. So they will not produce septic arthritis. They will not produce septic arthritis. So that is the how you have to apply these principles there. Okay. If it is 0 to 2 years of age, the osteomyelitis can become septic arthritis. Now your brain knows why it is. In 2 to 20 years of age, normal situation, they cannot become septic arthritis. Okay. If very rare long standing case, if the growth plate is destroyed, then it can become. Okay. But if it is more than 20 years of age, there is no growth plate. There is no growth plate. They can directly invade the epiphysis. They can directly invade the epiphysis. So if you understand the vasculature, you will understand the mechanism, you will understand the clinical outcome. Understand? So this is the importance of osteomyelitis in the long bone. Okay. Now let us go to the slide. Okay. So I discussed in the whiteboard about the different pattern of blood supply in different age group. So here again we are discussing about 0 to 2 years. In the 0 to 2 years there is a connection between the metaphyseal and epiphyseal artery, that is called transphyseal vessel. Because of this transphyseal vessel, see this osteomyelitis can go into the yellow color is the pus. It can go into the epiphysis through this transphyseal vessel and then it can enter the joint. It can enter the joint. It can produce septic arthritis. It can produce septic arthritis. Okay. So this is case of septic arthritis plus osteomyelitis. Understand? So in 0 to 2 years, this is the clinical outcome. Now let us classify osteomyelitis. See, we classify the osteomyelitis as a primary osteomyelitis and secondary osteomyelitis. Primary means infection directly happening in the bone. Infection directly happening in the bone. please don't talk. Infection directly happening in the bone, which means any trauma. If there is any direct trauma, the bacteria can enter directly into the bone. Or if the person is diabetic, he is having some infection here in the skin, in the subcutaneous tissue, that infection can go directly to the bone. That infection can go directly to the bone. For example, there is periodontitis, abscess, periodontal abscess, okay, or cavity infection that can go into the root, and it can go into the uh, canal, and it can go into the mandible, it can go into the ostia. So these are the direct infections. It is called primary osteomyelitis. It is called primary osteomyelitis. Secondary osteomyelitis means the infection traveling in the blood and going to the bone. Infection traveling in the blood and going to the bone due to systemic infections. Due to systemic infections. So that is called secondary osteomyelitis. Okay, the most commonest organisms which produce osteomyelitis are bacteria, or pyogenic bacteria. Pyogenic means pus producing bacteria, fever producing bacteria, and Mycobacterium tuberculosis. Mycobacterium tuberculosis can also affect the joint, especially the spine. The spine is affected. But remember, any organism can cause osteomyelitis. Any organism cause osteomyelitis. On based of clinical feature, they classify whether it is a pediatric osteomyelitis or adult osteomyelitis. And the duration of infection, if it is less than 2 weeks, it is called acute osteomyelitis. It is between 2 to 6 weeks, it is called subacute osteomyelitis. If it is more than 6 weeks, it is called chronic osteomyelitis. If the infection is producing pus, it is called pyogenic osteomyelitis. If it is not producing pus or fever, it is called non-pyogenic osteomyelitis. Routes of infection, the most commonest is hematogeneous. Hematogeneous means through blood. Through blood it can spread, or any trauma, penetrating injury, trauma, it can produce direct contamination in the bone. Indirect contamination means cellulitis, means subcutaneous infection seen in diabetic patient, which cellulitis is common in diabetic patient or immunosuppressed patient. Immunity is less in those patients, HIV patient, all those patients, this is very common. Then the infection directly goes from the subcutaneous tissue to the bone, that is called indirect contamination. So these are the modes of spread of infection to the bone. So now coming to the pathogenesis of osteomyelitis, because of sluggish flow of blood. Sluggish means slow. Where the blood flow is slow in metaphysis, because of U-shaped blood vessel, the bacteria settle in metaphysis and the inflammatory reaction starts, and they produce local ischemic necrosis of the bone. Because the pressure is increased, there is no blood supply. Now abscess formation, more pus is collected, that is called abscess. Then abscess enlarges, and there is intramedullary pressure increases. Then cortical ischemia happens, then it goes to the periosteum, below the periosteum. It goes to the subperiosteal space. Sub means below, periosteum, below the periosteum space, the pus travels like this. Understand? So this is very important, and they form a subperiosteal abscess, and the dead bone comes out like this. The dead bone comes out like this. Understand? So in the chronic osteomyelitis patient, there will be opening in the skin. From the bone, the pus comes out, and you can see small white particles, that are all dead bones. That are all dead bones. So the dead bone is called sequestra. The dead bone is called sequestra. Okay. So I will explain more about sequestra. So infection may reach the bone via 3 main routes: through the blood, direct contamination, indirect contamination. I will be asking cases from this area. Okay. So cellulitis, I give a history of diabetic patient. Okay. And in the cellulitis, okay, how the infection can go, it is called indirect contamination. So you should know about what type of condition can produce inflammation of the bone, infection of the bone. Okay, now it is very important. Why infection happens starts in metaphysis? Because I told it is highly vascular area, because all the blood goes to the metaphysis. All the blood goes to the metaphysis, and they have hairpin like arrangement of capillaries, so the blood slows down. So the blood sluggish, and they have more phagocytic cells than the epiphysis and the diaphysis. So the phagocytic cells takes the bacteria and they trigger the inflammation, and the cortex is very thin in that area. In the metaphysis, the cortex is thin. Because of this reason, the infection starts in metaphysis. Infection starts in metaphysis. Okay. So the pathogenesis varies according to the age group. The pathogenesis varies according to the age group. If the children is younger than 2 years of age, the infection spreads through the transphyseal vessel, and it involves the joint and the epiphysis. It involves the joint and epiphysis. If the children more than 2 years of age, okay, the epiphyseal plate, that is the growth plate, acts as a barrier. Acts as a barrier, and the spread of metaphyseal abscess to epiphysis is stopped because of the growth plate. Because of the growth plate. So after closure of the epiphyseal plate, that happens after 20 years of age, then the infection from metaphysis can involve epiphysis and enter joint. So in two age group, septic arthritis is expected. One is 0 to 2 years, more than 20 years. In between 2 to 20 years, they are protected by the growth plate. They are protected by the growth plate. Okay, now let us discuss about morphology of osteomyelitis. So morphology of osteomyelitis, I told you all know the end is necrosis of the bone, right? End is necrosis of the bone. That necrosis of the bone, dead bone, is called sequestrum. Dead bone is called sequestrum. The necrotic non-viable means dead bone is called sequestrum. Okay, and once the sequestrum is formed, this dead bone is formed. Okay, thus there will be periosteal reaction. There will be new bone forming here. Okay, and surrounding the sequestrum. So that is called involucrum. The new bone is called involucrum. Okay. So when you see a sequestrum, for example, the person is bringing out the pus, and you see a sequestrum, that is white particles. Okay. Then it is definite chronic osteomyelitis. Then it is definite. Don't need to ask how long the case was. Understand? If you see a sequestrum, the patient may say even 1 week. If you see a sequestrum, it is established chronic osteomyelitis. So for example, the person is having a pus here, okay, and just you are draining the pus and you are seeing bony particles, which means it is chronic osteomyelitis of the mandible. Chronic osteomyelitis of the mandible. Okay, that's why infection of the teeth you have to deal very carefully. If you allow, if it infect, especially the diabetic patient, if infect the bone, it is very difficult to treat. Any infection entering the bone, it is very difficult to treat. Understand? Even nowadays. Okay. So please understand this. When you see a sequestrum, it is established chronic osteomyelitis. Okay. So now practical approach towards the osteomyelitis. So remember duration. If it is 0 to 2 weeks, it is early stage. You have to treat aggressively in that stage. If you leave, then they become like a late stage chronic osteomyelitis. So sequestrum means it's a necrotic bone. See, this is the late stage. Okay, you are seeing this is the trauma patient. Okay, and they got some fracture, so they put a metal part here. This is a real case. They put a metal to fix the bone. They put a metal to fix the bone. Okay, and whenever there is a open injury, whenever there is a fracture, there is high chance for direct contamination of the wound. Direct contamination, direct infection of the bone. So what happened is this individual had a infection. Okay, so they gave high dose of antibiotic and they treated the fracture with the metal, and after few weeks they saw the wound site, the surgery site is swelling. It is reddish and it is swelling, and the oozing that comes out, the edema fluid comes out, and then they opened it. when they opened it, they saw, you can see some kind of pus here, right? Okay, in between the metal plate and the bone, that is called slime. That is called slime. And if you leave it like this, they become like a sinus opening in the skin, and the pus keep on coming out. Okay, whatever the treatment you give, they keep on removing the pus. In the end stage, we amputate the leg. So that's why oral infection also you have to treat very carefully, so that you should not allow them to become osteomyelitis. Understand? So involucrum means it is a new bone growth surrounding the dead bone. So what are the characteristic feature of acute and chronic osteomyelitis? Acute osteomyelitis, it will be less than 6 weeks. Chronic osteomyelitis, it will be more than 6 weeks. And they have fever, all the pain, everything will be there. It is an acute inflammation. And the patient will have very low grade fever, and the pain will be not so severe. Okay, they tolerate the pain, and there will be sinus opening. There will be opening in the skin. You can see the pus coming out and the bony particles coming out. Remember, this is the rule. Sequestra, you identify, then it is directly chronic osteomyelitis. It is chronic osteomyelitis. So in the X-ray you see sequestra, in gross you see sequestra, in microscope you see sequestra. It is a chronic osteomyelitis. What is sequestra? It is a dead bone particles. Okay, so chronic osteomyelitis, the problem is it keep on recurring. The pus keep on coming out, and they produce, bone becomes weak, they produce pathological fracture and growth disturbances, and in the end they become carcinoma. Carcinoma means cancer. Squamous cell carcinoma can come. Okay, so if I ask what is the complication of chronic osteomyelitis, any of these two, mainly you should write chronic squamous cell carcinoma. Okay, so now coming to the mandibular osteomyelitis, because it's only one slide, because as a dental student you should know about this. This is the most commonest thing you will encounter. Okay, so if there is any infection of the gums, so the soft tissue surrounding the teeth, or infection of the teeth, it can enter, and they form the subperiosteal abscess. Okay, and when there is subperiosteal abscess, the inflammation happening, that will obstruct the blood vessels, and that will produce again necrosis. So this is the scenario seen in mandibular osteomyelitis. That's why in the lab Sylvester will discuss any periodontal abscess or any dental abscess, don't take it lightly. Aggressively treat with very powerful antibiotics, and you have to solve the case at this level. If you leave it, if they become like this, the socket is infected and the bone is infected, then it is very difficult to treat. You have to remove all the bone in that area. Again you have to give antibiotic package inside, and you have to allow them to heal. And remember, even there is high chance of failure. Even in that technology there is high chance of failure, because it is very difficult for antibiotic to reach the bacteria inside the bone. Okay, so I don't want to go in details of it. So mandibular osteomyelitis comes as a complication, especially when the person is having less immunity, like HIV patient or diabetic patient, or the person is having cancer, he is on treatment. Okay, so these are the patients suffer like this. Understand? So they remove the complete mandible in some stages. Understand? So it is very, very difficult. So treat the patient, don't take it very lightly whenever you are dealing with the old patient or very young age children's. Okay, so I will finish these 3 slides and I will take the questions. Okay, only 3 slides is left, then I will take 5 minutes break. So now I am going to discuss about very important 3 slides. Okay, this is the one how the patient comes to you. It is called systemic effect of inflammation. Whether he has inflammation in the oral cavity or in any part of his body. Okay, the patient comes with fever. You all know in the acute inflammation I discussed why the fever comes. Because of increased prostaglandin. prostaglandin. So this prostaglandin synthesis, fever is characterized by elevation of body temperature by 1 degree to 4 degrees centigrade, and the fever comes as a any fever producing substance is called pyrogen. Pyrogen means fever producing substance that stimulate the prostaglandin synthesis around the hypothalamus. You all know hypothalamus, around the hypothalamus, because hypothalamus is the part of the brain which set the body temperature. So the prostaglandin goes to the hypothalamus, it increases the body temperature. It increases the body temperature, and most commonly the bacterial products, any part of the bacterial products can trigger acute inflammatory chemical substances TNF and IL-1 that can lead to increase in the prostaglandin, because they convert the arachidonic acid into prostaglandin by enzyme cyclooxygenase. So they produce fever. Now coming to the other three proteins synthesized by liver in acute inflammation, in any active inflammation. What are the three proteins? They are called acute phase protein. This is very important because we check this protein in the blood. So the proteins are C-reactive protein, commonly called as CRP. Commonly called as, in the lab, if you see the test, they call it as CRP. It is called C-reactive protein. Other one is fibrinogen, other one is serum amyloid A. But in the lab we do test for this CRP and fibrinogen. Okay. So CRP, we directly measure the for example, I take a blood. For example, Milad is having fever. I take a blood. In the blood, we measure directly how much CRP is. How much CRP is. If it is increased, then she is having severe inflammation. She is having severe inflammation. So we directly measure the CRP. If it is increased, it is a marker for systemic inflammation. It is a marker of systemic inflammatory response. Okay, fibrinogen, actually this protein we measure indirectly. This protein we measure indirectly because we take the blood. So we take the blood and put it in the tube. Okay, blood contains what? Plasma and cells, right? And the cells, they have RBCs, right? For example, if you take the blood and put it in the test tube, and if you keep, the RBCs settle down. The RBCs settle down. Okay, and it takes some time. It takes some time. If the person is having fibrinogen, more fibrinogen in the blood, what happens? The RBC settling will be fast. The RBC settling will be fast. So if it is like this, then the fibrinogen is more. Then the fibrinogen is more. So it is indirectly we measure it. Indirectly we measure. So so fibrinogen binds to the erythrocyte, means RBC binds to the erythrocyte, and they form stacks. Stacks means like a coin, one above the RBCs. It is called Rolex formation. It is called Rolex formation. This test is called erythrocyte sedimentation rate. This test is called erythrocyte sedimentation rate. It is a simple test for know the inflammatory response, to know the inflammatory response. And these are the three tests. One, the patient has fever, and we do erythrocyte sedimentation rate and CRP. Then we look what type of WBC is increased. Very simple. Then we look for what type of WBC is increased. If there is inflammation, the WBC will be increased. Generally, the WBC will be increased. Then we see what type of WBC is increased. If the WBC is increased, it is called leukocytosis. Leuko means white, cytosis means increased in cell. Leukocytosis. Okay, so normally in most of the infection there will be leukocytosis. Okay, so that's what in the blood we check total WBC count. It will be increased. And if it is bacterial infection, neutrophil will be increased. Neutrophil will be increased. So that is called neutrophilia. That is called neutrophilia. If it is viral infection, lymphocyte will be increased. Lymphocyte will be increased. That is called lymphocytosis. That is called lymphocytosis. If any allergic condition, asthma or hay fever or any parasite infection, eosinophil will be increased. It is called eosinophilia. It is called eosinophilia. So there are 5 WBCs, right? I told only about 3 WBC. One is, because that is commonly we see. One is neutrophils are increased, we suspect bacterial infection. If lymphocytes are increased, we suspect viral infection. If eosinophils are increased, we suspect allergy or parasite, fungal infections. Understand? So there are certain infections, leukocytes will be decreased. That is called leukopenia. You remember one example, that is enough: typhoid fever, which is very common. In typhoid fever, the WBC count will be decreased. WBC count will be decreased. I will make it very simple in one table, because this is very important, because you ask for blood test when the person comes with fever, right? So first sign of inflammation is fever. If the patient comes with fever, generally we do blood test. We see which area the infection is, we try to do clinical examination. After that, we try to do a investigation to know what type of inflammation it is. So 2 tests we do. One is we do cell counts. Other one is we look for what protein they have. We do ESR, erythrocyte sedimentation rate, CRP, C reactive protein. If both are increased in inflammation. Now cell count, we see especially WBC, total WBC count. If it is inflammation, it will be increased. Most common in all the inflammation response, it will be increased. Then we see 3 WBCs specially: neutrophil, lymphocyte, eosinophil. Neutrophil are increased in generally in bacterial infection. Lymphocytes are increased in what? Viral infection. Eosinophils are increased in allergic, parasitic and fungal infections. Understand? So this gives a clue the person is having active inflammation. This gives a clue what causes that active inflammation. What causes that active inflammation? With this background, for example, we know whether it is bacterial infection, we give antibacterial drugs. If it is viral infection, we give supportive therapy and antiviral drugs. If it is parasitic, if it is fungal, we give antiparasitic, antifungal drugs. If we give allergic, we suppress the immune system. Understand? So if you don't understand this, you will not able to treat them properly. Okay, I stop here.